Hello, this is James Lowry with James Lowry Hypnotherapy, where I, with the help of a medical professional, aid adults suffering from immune disorders in relieving the emotional stress surrounding their discomfort in order to achieve a better quality of life in as little as one session. Today's frequently asked question is: can blood tests detect immune disorders? Now, before I answer that question, I want to make it abundantly clear that the information I am presenting is not to serve as a substitute for medical advice. My role as a hypnotherapist is to serve as an effective adjunct to those already receiving medical treatment who might need additional care. Can blood tests detect immune disorders? They can. Blood tests can detect autoimmune diseases, immune deficiencies, and inflammation by testing for antibodies, immune cell counts, and inflammatory markers. It is crucial to test for these things if you have persistent levels or degrees of fatigue, infections, stiffness, swelling, joint pain, neurological abnormalities, or a combination of all of these things. If you test positive for an immune disorder, it is important that you begin to mitigate the severity of that immune disorder by immediately seeking treatment for that immune disorder, whether it be through adjunctive care or otherwise. At the root of many immune disorders is some type of dysregulation within one's neurology, nervous, and immune systems, or a combination of all of these. Thankfully, there is a branch of science known as psychoneuroimmunology, which studies how one's neurology and one's nervous and immune systems all interact with and affect one another. At the root of psychoneuroimmunology and its applications in the form of mind body therapies, such as hypnotherapy, is looking at where one's attention is placed, the degree to which that attention is gathered and maintained, and the overall emotional quality or flavor of that attention. Mind body therapies, such as hypnotherapy, aim to therapeutically affect attention in this way so that individuals can reestablish a healthy communication and form of regulation between their neurology and their nervous and immune systems. Now, you might be thinking to yourself, but James, I've tried talk therapies before and it didn't work for me. How is this different? Well, most therapies aim to alter or bolster your conscious perception of the problem. But if you could consciously decide right now not to have the discomfort you are experiencing, it would be reasonable to assume that you would consciously decide to do so. Would you not? If you could have consciously decided not to have taken on the discomfort at all, again, it would only be fair to assume that you would consciously have decided to do so by now. So the discomfort, the condition, and the maladaptive psycho-emotional responses that surround it do not effectively exist in the conscious mind. Rather, they are most predominant in the unconscious mind. So if you're looking to adopt this kind of therapy in order to treat the underlying causations of the condition, ones that reside predominantly in the unconscious mind, in order to relieve the emotional stress surrounding your discomfort, in order to achieve a better quality of life in as little as one session, then give me a call or book a free consultation at James Lowry Hypnotherapy. I'm always happy to help.